Welcome to the Bone Zone.
Thanks for that, Zane. You did a great job. Today in the Bone Zone, we're going to be covering the femur. According to this script I'm reading, the femur is the longest and strongest bone in the body, if you know what I mean. The femur's long bone is a long bone and consists of a proximal extremity, a shaft, and a distal extremity. It articulates superiorly with the os coxa, like this, which is the hip joint, and inferiorly with the patella and tibia. Can't do that right now. Sorry. Let's stick to the proximal extremity. Well, we've got our head, which has the fovea capitis femoris. This is important because it's the attachment of the ligamentum teres of the femur, which conveys a small artery, to the head of the femur. Important during early growth, but not a major blood supply in the adult. Then you've got your neck, which is most commonly fractured when you fracture your femur. You've got your greater trochanter, which is this big guy right up here, and that's the attachment of the gluteus minimus and medius, the piriformis, the obturator internus and externus, the gemellis, and quadratus femoris muscles. Then you've got your lesser trochanter, much smaller, attachment of your iliopsoas muscle. On your anterior aspect, you have your intertrochanteric line, which is important because it's the lateral most attachment of the hip joint capsule. Everyone knows that. On the posterior portion, you have your intertrochanteric crest, which is between the two trochanters. I think this is probably a good time to tell you that you need to know right from left. Easiest way to do that, well, you know that your head is medial, because it does something with your hip joint. I don't know. What's the word? And then you've got your trochanters, which are in the posterior aspect. So if we turn it that way, you know that your hip is medial, so this is your left femur. Alright, moving on. This is your shaft. You've got a couple things on there. You've got your linea aspera, which is the line that's just running down the posterior aspect of the shaft. You've got your spiral line, which runs up and medial to kind of to the head of your femur. You've got your gluteal tuberosity, and we all know tuberosity means rough stuff. So there's some rough stuff right here. Zane, let's be professional. So that is the attachment of the gluteus maximus muscle.
Nice.
There's also the medial and lateral supracondylar line. Well, let's see. What does that mean? Well, you got your medial side and your lateral side. Supracondylar. We both know these are the we all know these are the condyles. So you know supra means above. Above, so above condyle lines, right here. You got your medial side, which you can see the head, and the lateral side, which is not the head. Let's see. Now we can move on to the distal extremity. What we have here, I'm going to turn it up like this. We've got our medial condyle, our lateral condyle, our patellar surface, which is in front, our intercondylar notch, or fossa, and finally, on our, I'm having a little trouble, on our medial side, because we know adductors are medial, is your adductor tubercle, which is the insertion of your adductor magnus muscle. And that pretty much wraps it up. I hope you guys enjoyed the Bone Zone.